Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. Today our video is going to be talking about Achilles tendinopathy and how that relates to the menopause and whether there's any evidence that HRT can help with this. treatmyachilles.com is an online physiotherapy virtual platform where we can assess any Achilles injuries and give you a rehab protocol afterwards. If you would like any more information about our website and what we can do in our assessments, please have a look in the information below. So what I want to do is go through a few different things today. First of all, what causes an Achilles tendinopathy? What is the menopause and perimenopause? How those things might be related together, so how can the menopause, perimenopause help cause an Achilles tendinopathy? What can we do about it, and would HRT help with that? So how we develop an Achilles tendinopathy? Well, if we look at the anatomy of our Achilles tendon, it is made up of our calf muscles coming down, turning into the tendon and attaching it into the heel, which you can see from the picture. These two calf muscles are your gastrocnemius and your soleus. As they turn into the tendon is made up of lots and lots of bundles of fibres of collagen. When we're doing exercise and when we're doing activity, which could be time on our feet, what we're doing is we are adapting to that exercise once it's finished. So our tendons naturally go through a cycle of a little bit of micro damage, which is completely normal and what you'd expect to find with exercise, and then a cycle of our body removing any waste products that it doesn't need and replenishing that with new collagen fibres and making those more stronger and more robust. So this takes a natural period of time. When we're doing loads of exercise, so we suddenly have a peak in our load, i.e. we're suddenly doing a lot more, and this peak in load cannot just be exercise, it might be just a change in the load through the tendon. So for example, wearing flip-flops or having a couple of weeks off because we've been poorly or on holiday and then going back to normal life. When we are noticing a change in activity, so we've gone from less to more of that load through that Achilles tendon, if we're doing that on repeat quite regularly, we're going to beat that cycle. We're loading it before our body has time to adapt to it. So then our Achilles starts shouting at us and saying, I'm not ready for this activity, I'm not robust enough to cope with it, and that's when we start getting symptoms. We have some other videos based on what is an Achilles tendinopathy, why you might have certain symptoms, and again, links to those are below. So with the menopause, let's change tack for a second and talk about what are the stages of the menopause. We have the perimenopause and the menopause. And the perimenopause can start quite young, in late 30s, you can go through early menopause. It tends to be around mid-40s in most people, and then it moves on into early 50s. The perimenopause is a time that our hormones, particularly estrogen and progesterone, are fluctuating but gradually dropping and decreasing. Once we have had a whole year of no periods, that is then known as the menopause. So that day of a year after the last period is the time that we say that you have gone through the menopause, and that tends to be when those hormones have evened out at a lower level than what they were prior to any of this starting. So how does this have an effect on tendons? Well, we know that the change in our estrogen particularly has a change with what's going on in those bundles of collagen fibres, and we get a change in the amount of collagen that we have. So therefore, that cycle of replenishing the collagen fibres and removing the things that we don't need anymore once we've exercised takes a little bit longer. We take more time that we need to recover. So the cycle's happening, but we need more time to recover afterwards. So typically with an Achilles tendinopathy, if you can see some of the videos about why I've got a lump or a bump in my Achilles tendon, you see if you were to scan people with Achilles, a thickening. And that thickening means if I measured the diameter of your Achilles tendon on an ultrasound scan with an Achilles tendinopathy, In most cases, it tends to be larger than on the scan of your other foot that doesn't have an Achilles tendinopathy, or comparing that to other people that don't have them. So that thickening, that increased width of that Achilles tendon has been also linked with people that are having postmenopausal when you have an Achilles tendinopathy. For women that are taking HRT, when we're taking HRT, that change has been shown to get better. There is less thickening in the control group taking HRT of active women compared to the group taking no HRT. It's thicker in that group. Now, there's a lot of information we need to interpret from this. People can have changes on a scan and have no Achilles tendinopathy problems. People can have changes on the scan that are very minimal and have high levels of symptoms. What these research papers don't show us is the correlation between those that are doing any rehab exercises and HRT and whether that's improving, people with symptoms and taking HRT and that's improving. The only thing it's telling us is that diameter is getting less. It's making that bit better. We can extrapolate that information and say, well, maybe that means then my symptoms will improve and I can do more, but these research papers aren't out there yet. There has been started to be some research papers on gluteal tendinopathy where people have put their HRT over that area with a gel or a patch and then done some strength training and to see whether there's a difference. But unfortunately that paper was a little bit flawed in that it only checked people for about 12 weeks, where actually that could be and should be a lot longer with that rehab program. And it also was an interesting set of exercises that they gave people to do for that rehab program. It may not be necessarily something that I would prescribe. So the jury's out a little bit on whether HRT can help, but the indication is really positive. If we're then looking at what can we do, how can we help our tendons normally, there's a lot of things we can do. One, expect recovery to take a little bit longer. Listen to our bodies. Are we feeling more stiffness? Are we feeling more of that 24-hour pattern? So something's happening when we're doing exercise, might feel okay. A little bit later on, are we feeling some symptoms? And then feeling more that next morning when we first put our feet to the floor. If that pattern of what's happening after 24 hours is increasing in symptoms or we're increasing in stiffness, it gives us a clue we need more rest and recovery between our activity sessions. So things that typically load an Achilles tendon with sports tend to be more running based or jumping based activities. So you could cross train in between those sessions, for example. So it could be swimming, it could be using an elliptical trainer, it could be going on a bike. So you're not putting as much force through that Achilles tendon compared to those running and jumping sports. We also then need to have a look at strength training, and strength training is wonderful for people going through the perimenopause and menopause. It helps prevent lots of aches and pains. It helps us get stronger as we're older, and if we're looking to, once we've passed through this, it helps reduce the risk of falling. It helps us keep more functional as we get older. But strength training is also the #1 best exercise, as the best treatment, for Achilles tendinopathy. And getting advice on a particular protocol for you, bearing in mind your perimenopausal menopausal status, is also important, because it may mean that you don't have to do these exercises daily. In fact, there's not very many people that do need to do these daily all the way through their program of rehab. So in summary, the perimenopause and menopause changes what's going on inside the collagen fibres within our tendon. It may then mean that natural cycle of adaptation that we have with exercise just needs a little bit longer recovery time in between. We can do things about it by thinking about how our body responds 24 hours after that exercise. Can we give ourselves more rest period? Can we cross-train? Can we get a strength program that is relevant to us as individuals? Thank you very much.